Live from Wave in Louisville, Kentucky. This is Listens Live.
Hello, everyone. Good afternoon to you, and thanks for joining us here on Wave Listens Live. I'm your host, Brian Schlonsky, and today, of course, it is Wednesday, so we are working our way through this work week. We've got a lot to cover today, so as we go to the rundown now, let's show you what you can expect on the show today. We've got a special report coming in from Aurora, Colorado. It's on new investments being made at a new Philip Morris plant, and that is creating jobs and making an impact right here in Kentucky. So we'll have that report for you coming up. We also have the creators of the Peacekeeper. It's an innovative way to make your next road trip. Make sure that the back seat is nice and peaceful for you. But up first here today, we have got Freedom Mini Dental Implants back with us on Listens Live to make sure that you get the smile that you deserve. So here, as always, Dr. Regan Ackerman from Freedom Mini Dental Implants joining us here on the set. It's good to see you.
Hi, nice to see you.
It's been a little while since you've been here, so maybe first we could do a quick refresher about the business that you run and the ways that you specialize in something a little different.
Yeah, so I'm a general dentist that specializes in what we call mini dental implants. The mini part is just that it's a smaller diameter implant, so it's a lot less invasive. Shorter healing time, usually less expensive than the bigger surgical implants. And the way I use them, I can replace single teeth, missing teeth, but one of the biggest things I do is people struggling with dentures, people using gobs of denture glue. I can make their denture snap on to the mini dental implant or get rid of the denture completely so they don't have to have dentures anymore. But it's just a smaller diameter, less invasive way. And a lot of people that might have maybe not been candidates for the bigger surgical implants could be a candidate for the mini dental implant.
One of the best ways to show what a mini dental implant is by showing the models, which you've brought here today. You have several different ones.
Yeah, certainly. So I'll start off kind of with one of the most common things I do, what we call a denture stabilization. So many people are struggling with dentures. They can't keep them in, they gag them, they have to use tons of glue. So with the mini dental implant, so imagine this is someone's mouth missing all their teeth. I just numb them up with a little local anesthetic. I do not have to sedate them or put them to sleep because I'm not making any incisions or stitches. I essentially make a little pilot hole through the gum into the bone, and then the mini dental implant is it's a one-piece, small diameter titanium screw. The day I place these implants, I am able to put these attachments inside their denture, and they leave that day with the denture now snapped on to those implants. So no more denture glue, no more floppy denture. So many people wear, especially that lower denture, they say they wear it in their pocket because it doesn't stay in. So now their denture will snap on and they can eat foods again, and they just snap it out once a day, rinse and clean it, and then snap it right back in. Another huge advantage of the snap-in denture, a lot of times we can trim some of that off the roof of the mouth to help with that gaggy feel.
Some of the people that you help with their teeth are folks that maybe don't need that much, and maybe it's only a single tooth or a partial replacement.
Yes, yeah, I do that all the time as well. Recently had a patient come in, missing a front tooth. They had a flipper that was just miserable to wear, like a partial that came in and out. So I was able to place the mini implant, like I said, no incisions, no stitches, and then left with a temporary that day, and within a month had the permanent tooth that we then cemented on permanently onto that implant. And then no more flipper, no more partial. It's kind of like they grew their tooth back. A lot less invasive than the big surgical way, and it's not like a 6-month, year-long process. So
the third model that you have, another way that you're able to help your clients.
Yeah, so this is fantastic. I love doing this for patients. This is what we call the permanent teeth, where you can get rid of the denture completely. So no more bulky denture. Placing just more implants the same way, no incisions, no stitches, don't have to put you to sleep. But then I'm able to make a bridge of teeth, which is a lot less bulky than a denture, made out of a much stronger material. And this gets cemented permanently onto those implants. So it doesn't come in and out. It's like getting your natural teeth back. but then you have nothing on the roof of your mouth. You get to taste all your food again, and you don't have any of that bulkiness of the denture. And you're just going to brush it and clean it every day like regular teeth, and we give you a water pick to use, and you get it cleaned, and it's, you know, closest thing to getting your natural teeth back.
I think the fourth model that you have here really shows, obviously it's in the name, Freedom Mini Dental Implants, but this does a really good job of showing what mini really means.
Yeah, because, so many people are like, what's the mini part? Is it a tiny little screw? But it's just, like I said, a smaller diameter implant. So it's not this big one that you can visibly see. There's a tiny little hole here, and that's the pilot hole I make to place the mini dental implant. So as you can see, I don't have to make any, you know, incisions or stitches, and I don't have to have as much bone. So a lot of people that were told they weren't candidates for these bigger implants could still be a candidate for the mini implant. I see it so many times, especially on lower dentures. They couldn't have bigger implants, but I'm able to do the mini dental implant. I don't have to do bone grafts or sinus lifts because I don't have to have as much bone as with the traditional implant. And it also heals up faster because it's a lot less invasive. So like I said, you don't have to wait 6 months to use that implant.
It's an exciting process for patients because a lot of folks you're getting your smile back, you're getting your personality back maybe in some cases. And so I know you have some before and afters that you brought today, and they really show the important work that you do.
So this is Connie. She had to have all her teeth removed. So this was before when she wasn't really, and then we did the permanent teeth for her, and just life-changing. She smile again, eat again, taste her food again. So those are the permanent teeth that we did on Connie, and you know, life-changing as far as getting her smile back.
You can tell in the photos, and as we go through here is your second patient you helped.
Yeah, Martha. So same thing. She had her teeth taken out, could never tolerate dentures, had not worn anything for years. I was able to make her dentures and do snap-in dentures, and she was able to keep those dentures in, not have to use glue, and able to tolerate them and eat and smile again.
It's a just beautiful transformation, both of those first two, and I think we've got probably one more to show, just two today. But beautiful transformations, and I imagine that a lot of people, you talked about folks with this model that have maybe been told by other dental practices that they're not a good candidate for types of things, so people have put it off for a long time.
Correct, yeah, and we do a free consultation. It's no charge, so just please, if this is something that you think you need or interested in, call the office. It's a free consultation. I'm the only dentist. We're locally owned, so you'll see me, and it includes a 3D x-ray because we always want to make sure you do have enough bone, but it's pretty rare I have to tell somebody they're not a candidate for the mini dental implants. So please call. We're located on Bardstown Road in the Fern Creek area.
I was going to say, for anybody that's, we've got the number and everything up on the screen here, that knows that this is the next step that needs to be done. Sometimes it puts people at ease to know kind of how that process works. You talked about the consultation. That's kind of the day where everybody figures out what it is, what the plan is going to be for them. Okay.
Yeah, the consultation, like I said, we take the 3D x-ray. I'll do an exam, and we'll go over the treatment plan. I'll explain the process, you know, in more detail. We'll go over any cost. We do have financing plans if anybody, you know, needs, you know, monthly payment plans and things like that. And then we get started with treatment. And a lot of times, if somebody already had all their teeth removed, you know, we're moving. We're either making new dentures, and sometimes I get this question a lot. If you have dentures that you like the way they look, they just don't stay in, sometimes I can use your existing denture and convert that to a snap-in denture and save you some money that way as well.
The main thing is there are so many options that you're able to use to help your patients.
Yes,
and we're glad
that
we have you here locally to be able to do that. Thank you so much for being here today, and
Thanks for having
we'll
me.
see you again soon.
Yes.
All right, stay with us here on Wave Listens Live. We've still got 2 more great segments to go. Coming up next, we've got a report. This is from Philip Morris talking about a new investment in Aurora, Colorado. This investment, though, it's making an impact right here at home in Kentucky. We'll show you how coming up next.
The Wave Charlie.